Welcome, Janet.
Thank you very much, Val, and good afternoon, everyone. Thanks very much for the invitation for WSPS to participate in this May Day virtual webinar series. We've enjoyed a wonderful collaboration with our health and safety system partners over the years. And although the focus today is on COVID-19 pandemic, in terms of workplace mental health in general, WSPS has benefited greatly from the expertise of this group. In fact, some of our system partners have contributed a case study to one of our WSPS courses that is now up and running called Workplace Mental Health, What Health and Safety Committees Should Know. So I just wanted to thank you for that collaboration. Just to tell you a little bit about myself, my background is actually nursing. I've worked as a public health nurse with Ottawa Public Health and also as a nurse consultant with the Public Health Agency of Canada, and started with WSPS as a workplace mental health consultant about 5 years ago. I'm certified by the Mental Health Commission of Canada as a mental health first aid instructor and also a CMHA certified psychological health and safety advisor. So this presentation today is based on a series of virtual webinars that WSPS has been providing as part of its Safety Connection program. And Safety Connection is a forum where health and safety professionals can connect with each other, exchange ideas, and share best practices in health and safety. And you can see on the screen the goals of our Safety Connection program. In the last month, we have facilitated a number of webinars on topics related to the COVID-19 pandemic. And two of them have been on mental health, one called Protecting the Mental Health of Employees Working Remotely, and the second one, Protecting the Mental Health of Frontline Workers. And so today I'm going to be sharing with you very quickly some of the content that we cover in the Protecting the Mental Health of Employees Working Remotely. So this graphic shows a very calm home scene with young children quietly entertaining themselves in the background while their mother is working. I think the day-to-day reality is probably quite different. I think what more likely we're seeing is a mom trying to participate in a video conference while feeding the baby on her lap with a toddler coming in and out of the background in various stages of getting dressed, and the dog barking because someone has just rung the doorbell. I don't think it's quite as idyllic as this graphic would suggest. We're all feeling a little bit vulnerable right now, and today's discussion could trigger some mental health responses. So if you are feeling distressed or triggered by any of the discussion, please reach out to a family member, a friend or a colleague, or contact your nearest distress center. And I'm just going to put on the screen the number for Crisis Services Canada for a listing of the national crisis hotlines. You can see the items that I'll be talking about in the next little while. In our Safety Connection sessions, we try to make the content as interactive as possible. And so we use a number of polls as well as Q&As to engage participants in conversation. For time reasons, I won't be including the polls in today's presentation. But when you look at that graphic that says social distancing, I think over the last couple of months, more and more, people are choosing to emphasize the importance of physical distancing, but still socially connecting. So I'm going to make reference during the presentation to a number of different resources, and you will have an opportunity at the end to download a document called COVID-19 Mental Health Resources that will capture many of those resources. So it's a true understatement to say that COVID-19 has changed our world. With this pandemic, the simplest tasks have become much more complicated, if not impossible. Picking up groceries, visiting the dentist, trying to get your hair cut, keeping up with schoolwork, and trying to work remotely, and always with a 2-meter buffer zone around us. A few months ago, I don't think we could have imagined that we might need to watch a YouTube video to be able to unpack our groceries safely when we bring them home from the grocery store. By remote work, I'm referring to any full-time, part-time, or it could be project-based work that someone is doing outside of their organization's office. So in many cases, that would be working from home. In pre-COVID-19 days, it might have been working at a coffee shop or even out of your car. And obviously needing to harness the power of the internet to enable us to stay connected with our work colleagues. But working remotely can be much more difficult than it seems. Most have had to adjust to remote working very quickly with no time to prepare, lack of proper equipment, and little training. So not only has the COVID-19 pandemic impacted the way we are operating right now from our remote work locations, but it's going to dramatically change our way of working in the future as well. And all these changes are contributing to increasing levels of stress and anxiety for many people and having a significant impact on our mental health. In fact, a recent Angus Reid survey reported that nearly half of Canadians said that their mental health was suffering due to the pandemic. I want to talk for a minute about the enhanced authority of public health. The Occupational Health and Safety Act has a requirement that employers have a general duty to protect workers. And within the federal context, the Canada Labour Code Part 2 has similar language, speaking to the requirement for the employer to ensure the health and safety of all employees. However, none of this legislation provides any specific guidance about managing health and safety in the midst of a pandemic. So public health is the new authority that all levels of government, workplaces, and communities are listening to. The Public Health Agency of Canada, the Chief Medical Officer of Health, the Ontario Ministry of Health, and local health units are providing direction to all elements of society, and political agendas are taking a back seat to health promotion and protection legislation and scientific evidence. People are also listening to the media. As well as reporting on the recent number of COVID-19 infections, the media are focusing a great deal of attention on the threats to our psychological well-being. Mental health is front and center during this pandemic and has become a prominent theme as all ages struggle with increased levels of stress, anxiety, and depression. So positive mental health is critical to our overall health. And when I think about health, I like the World Health Organization definition, that health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And although mental health is only one component of overall health, it has considerable impact on our overall health when it's not maintained, nurtured, and balanced. And mental health is equally important to maintain as those other two elements of our health. I want you to imagine for just a minute your overall health as a three-legged stool. By design, the stool is sturdy, it's balanced and supportive. However, if one of those legs were broken or missing, the design would be compromised and unbalanced. In fact, the remaining two legs would have to work harder to balance and support the weight. Hence, the stool would not be functioning optimally as it was originally designed. In terms of our mental health, this is also a World Health Organization definition, but I would like you to pay attention to a couple of phrases in that definition. Cope with the normal stresses of life. We are no longer trying to manage the normal stresses of life, but rather struggling with unprecedented upheaval in all aspects of our lives. Contributing to community. This is more difficult with all the physical distancing limitations in place, but fostering social connections are essential here to maintain our feelings of productivity and fruitfulness. We're seeing people from all walks of life stepping up to help others in their communities who are less fortunate, and seeing businesses evolving their product lines to meet the need for vital equipment and supplies. In our Safety Connection polls, we invited participants to share what issues or challenges were creating a lot of stress for them during the pandemic. And fear of contracting the virus, of course, is why many of us are working remotely today, trying to stay at home to reduce our contact with others and limiting our outside contact to essential activities, such as picking up groceries or prescriptions, attending medical appointments, and getting out for a bit of exercise. Some might be in a higher risk category due to age or pre-existing medical conditions, and others are worried about young children or elderly relatives getting sick. There are many losses and changes to deal with during this time in our history, not only related to grieving the loss of someone who's died from COVID-19 or other causes, but also losses related to disrupted schooling, lack of playmate contacts for children, the demise of our face-to-face social connections, and some of our usual activities and hobbies. Many businesses have been forced to close down their operations, either entirely or partially, and lay off staff. And large number of employees are no longer receiving a regular paycheck and struggling to make ends meet for basic day-to-day expenses. These are the kinds of problems that are keeping people awake at night, just having enough money for groceries, covering rent and mortgage payments, along with all the other stressors that they're dealing with on a daily basis. Even those who have a roof over their heads can be worried about close quarters. For example, thinking about elevators in condo buildings. Is it safe to touch the buttons as I go up and down? Or the risk of overcrowded public shelters. And sometimes staying at home, which we consider to be our safe option, isn't a safe option in the case of domestic violence. We are naturally social beings, so the requirement to self-isolate at home and maintain physical distancing outside the home can compromise our need for social connections. There's been an increase in drug and alcohol consumption as people have exhausted their usual mental health coping strategies and turned to substances to self-medicate for relief. The closure of schools and daycares has created a whole new host of challenges for parents who are trying to work remotely, and these stressors are having a significant impact on our health. We know that stress impacts our body, our mind, and our behavior, and our stress response prepares the body to react to emergency situations. However, chronic stress over long periods of time can have a negative effect on all parts of the body. And you can see some of the parts that are affected when we are in a chronic state of stress over a long time. In terms of our mental health, back here for a moment, the stress due to the uncertainty and lack of control during these unprecedented times can lead to increased levels of anxiety. People may show severe symptoms of anxiety and describe a racing heartbeat, nausea, sweaty palms, feelings of helplessness, and a sense of impending doom. There's an increase in the number of people describing feelings of low energy or sadness when their usual coping techniques are not available to them. Suicide is likely to become a more pressing concern as the pandemic period continues and people experience growing despair in their circumstances. According to a recent Ipsos poll in April of this year, 54% of Canadians felt lonely or isolated during the pandemic. And if we look at the 18 to 34-year-old age group, that rises to 68%. Technology is certainly helping, with 93% of us using technology to stay connected. We know that our cognitive functioning can suffer, that the continuous presence of stress hormones, such as cortisol and adrenaline in our body, may alter the operation and structure of some aspects of the nervous system. As a result, people who are chronically stressed may experience confusion, difficulty concentrating, or difficulty with decision-making. Chronic stress can also exacerbate pre-existing mental health issues, such as mood disorders, anxiety disorders, etc. Before COVID-19, the Conference Board of Canada research in 2016 indicated that depression was costing the Canadian economy $32 billion a year, and anxiety costing $17.3 billion a year. So we don't know the long-term consequences of having to be isolated for extended periods of time. However, many organizations are conducting surveys, such as the one that the Conference Board of Canada Mental Health Commission of Canada and WSPS conducted on the impact of mental health pulse survey that looks at the current state of Canadians' mental health and their coping strategies. And those results are to be released shortly. So what can employers do to mitigate the risk to mental health from COVID-19 and protect their employees? When we polled participants about what their employer could do that would be helpful, we received responses similar to what you see on the screen. Communication is more important than ever with a workforce working remotely. Staying connected with staff is paramount, and communicating often about the current status of the organization, what changes are occurring, and the impact of those changes on staff will help employees feel included and supported. Especially during this time of upheaval, we need leaders who have emotional intelligence, leaders who are self-aware and can adapt to changing circumstances, who understand their impact on others and are able to communicate with empathy and manage relationships positively. We expect our leaders to have all the answers, but unfortunately there's no playbook for operating during this COVID-19 pandemic. It's important as a leader to remain calm and provide reassurance as you try to navigate the path forward. Employers can ask their employees what kinds of supports they need and invite their involvement and input into coming up with practical solutions. I really like the advice provided to leaders by Louise Bradley, the President and CEO of the Mental Health Commission of Canada, and Dr. Bill Howitt. They said that being kind is more important than being right, and being vulnerable is your superpower. So show your own vulnerability as a human being by empathizing with those reporting to you and being kind. Demonstrate flexibility in dealing with the difficulties your employees might be experiencing, trying to juggle their personal responsibilities. Support staff in adapting to their remote work challenges and encourage them to connect with one another and their manager by phone, by teleconference, internet, and social media platforms on a regular basis. Think about obstacles they might be experiencing in their new temporary workspace, such as isolation, inefficiency, and technological challenges, and include staff in coming up with solutions. Think about the need to develop shadow policies about self-isolation, ordering supplies at home, etc. You might never have felt you needed to have policies addressing these issues in the past. And muster all the resources that you have to provide as safe and healthy an environment as possible to help employees remain engaged. Remind employees about the availability of employee family assistance programs, if you have access to them, and other community resources. And encourage your workforce to take time to focus on their self-care needs and be a good role model as a leader in making your own self-care needs a priority. However, in addition to providing external resources, think about the importance of building your own internal resilience to help you cope with everything that's going on. And we hear a lot about the term resilience, but what it really is the capacity to recover quickly from adversity or life's challenges. It's the ability to bounce back and continue to cope well, even in the face of crisis without long-term negative consequences. During this global crisis of COVID-19, there are many situations that will test our resilience. And building resilience seems to have some preventative mitigating impacts towards dealing with these negative situations. If you don't feel you as a leader or others are very resilient, the good news is it's a collection of skills that can be learned. And it's a matter of training your attention on more positive aspects of your life to try and decrease some of the negative thoughts that are so present in most of us. So let's take a look at an easy way to start to increase your resilience and consider building self-care into your daily routine and that of your employees. In our polls, we asked participants what self-care measures they took to protect their mental health. And you'll see a number of different examples of self-care activities on the screen in front of you. This is by no means a comprehensive list, but many of these are backed by scientific research. And you'll notice that many of them have no cost associated with them. Going for a walk, for example, getting outside in nature. There's enough science about the health benefits of nature to get the attention of the medical profession. And doctors are now starting to prescribe nature walks as part of their medicine for their patients. Watching a comedy, we have so much negative news that we're hearing in our news reports on a daily basis. We need to laugh, and we need to be able to forget about some of those stories for a while and remember to think about some of the more positive elements that we can relax and enjoy a comedy and some other laughter. Connecting with family and friends. We have lots of different social media platforms now to be able to do that. However, don't forget to pick up the phone and talk to people as well, as we're starting to hear that people are already becoming a little bit zoomed out from all of the social media platforms. And this brings us to the self-care activity of consciously being kind to yourself. Watch yourself talk. We're often very hard on ourselves without realizing it. We have thousands of thoughts a day, and the majority of what we think is unconscious, and we will automatically think that more negatively and be self-critical instead of self-affirming. However, studies have shown that if you can think kind thoughts about yourself and your loved ones, that it has psychological and physical health benefits. We also asked our participants what it made it difficult to be able to make self-care a priority. And you can see some of the types of responses up on the screen. No time is a big one, but remember that self-care can take only moments of your time, even just stopping to do some deep breathing and to feel how tense certain parts of your body are and to consciously release them can be very beneficial. The physical distancing has made it difficult for us to get together over coffee or dinner with friends, but we can still connect with them through social networking platforms and ensure that we maintain those social connections. Sleep difficulties, we know that sleep is important, but the increased anxiety during this time may disrupt sleep and can really increase the impact of stress on our lives. Dr. Jody Samra of My Workplace Health has put together some videos with tips for better sleep, and we've added that link to our resource list. So if you're having trouble motivating yourself to make changes and to focus on self-care, we suggest that it makes a lot of sense to create a self-care plan. When you write something down and you tell others about your intention, you're more likely to follow through with that. And so you'll see a sample self-care plan on the screen. So it doesn't matter whether it's physical, mental, or a social focus that you're wanting to think about in terms of your own self-care. Jot down what are those first practical steps so that you can even get out of the house to go for a walk. If you're thinking about gratitude moments, that can be a very effective way to affect the neuroplasticity of the brain and reconfigure it to feel more positive about life. And there are many gratitude apps out there, including one called 10% Happier for the skeptics out there in terms of working with these kinds of apps. In terms of supporting colleagues and others, I can't overemphasize just how important it is to support and encourage our organization's most critical resources, our employees. It's easier to replace your material and financial resources than to replace your human resources. A close colleague, a top talent, or someone with institutional memory is irreplaceable. And so during this period of uncertainty, it's critical to prioritize staff, let them know how valued and supported they are. And so some of those ways to do that are having a workplace buddy to connect with. It can have a positive impact on our mental health. Gallup research has identified that having a best friend at work was one of the major criteria that kept people engaged at work. Listen without judgment. This seems quite a simple thing, but we don't actually do very well at it. We're often, when we're listening to someone, we're often trying to figure out what advice to give or how to fix the problems. And it's most powerful if we just listen, paraphrase, and are empathetic to another one's experience without judging them. Avoid giving advice. Most of us default to wanting to give advice, but from a manager perspective, it's not your role to fix, rescue, or be a therapist. Instead, it's important to ensure that the workplace itself isn't creating mental harm and to encourage people to reach out for professional help or to access community resources. And finally, it's important to reassure people that stress and anxiety are normal responses to a very abnormal situation. This is the first time that any of us have gone through something like this, and the overwhelming emotions and concerns are our body's response to keeping us safe. So I'm just going to end with a couple of slides on resources. Think about your internal resources. What existing policies and procedures do you have? Do they need to be revisited or updated? Do you need some new shadow policies that you haven't had to have because of the situation in the past? What about human resources? Can they assist you in providing information about accommodation issues and reminding employees about benefit allowances, time off, etc.? If you have unions, health and safety committees, benefits people, or wellness committees, reach out to them for their input and leadership. Remind employees and managers about your employee family assistance program if you have one, and how to access services. If you don't have an EFAP, consider developing a list of community resources using 211.ca to find out what resources exist in your own local area. And of course, wellness programs are important as we all try and stay physically healthy to keep our immune system strong. Online training, check with your check with the system partners for information about any virtual training options that are available. For example, WSPS is in the process of developing virtual workplace mental health courses on topics such as raising awareness and how managers should respond. So external resources, you'll see I've identified a couple on the screen there. These are listed on the resource that Val's going to make available to you in the chat room. Resource is called COVID-19 Mental Health Resources. But there are some great resources there from the Mental Health Commission of Canada, from Canadian Mental Health Association, the Centre for Addiction and Mental Health, and more recently, Wellness Together Canada, which is a mental health portal for Canadian adults and children where they can access free mental health services and support any hour of the day. And I just want to end my presentation by sharing with you a few comments from participants who have attended our Safety Connection sessions. We intended these to be interactive and to give people a safe place to talk about what is really important to them in dealing with COVID-19. And respondents have told us that sharing of mental health struggles through our polls, feeling less alone, understanding that anxiety is normal during these abnormal times, and knowing what resources are available have been some of the things that they have valued most from our Safety Connection sessions. So I'm happy to answer any questions, although I know we're already a few minutes over time. So at this point, I'll turn it back to Val to include a link to the COVID-19 mental health resources that you may want to download. And I've left you my email address if anybody is interested in additional information. And thank you very much for your attention this afternoon.
Thanks, Janet. You did a great job of catching up the time too, since we ran later earlier. So I really appreciate the presentation and the perspective on everybody, no matter what level of the workplace, needs to think about themselves and also think about how they're relating to each other at this time of elevated stress and just in dissonance, I guess you would say. There was a reinforcement of your comment with respect to getting back in touch with nature, because I'm not sure that the link was in the PowerPoint at that stage. So that was one comment. And another question has come up about resources specific to supporting staff working remotely when it comes to domestic or intimate partner violence, I actually put in a link to make it our business.ca, which is a program that I've worked with in the past when I worked at a university. And I see that they have a COVID page, but I don't know if you at WSPS or anybody else on the call has any other resources that they would suggest in that regard. I know that some countries they've had codes and messages in the UK, for instance, but I'm not sure of ways to access help and that kind of thing. It's a good question. Janet, are you there?
Hello, can you hear me?
Oh, yes, now I can, yes.
Okay. We haven't developed any particular resources at WSPS around domestic violence, but we just wanted to highlight that as much as we're telling people to stay at home and to physically distance, that there are people certainly who can't stay at home, that it's not safe because of domestic violence. And so there are certainly resources that are on the Ministry of Ontario website at the federal level as well. And I'm sure among our partners, there may very well be some resources that people are particularly familiar with that have been very helpful.
Okay, and this is another comment more around that the stressors of any of the stressors that we're experiencing now existed before and won't go away. And that we use language of bring the stressor into focus or being elevated rather than continuing to say experience during COVID, as though though when COVID goes away we don't have to concern ourselves with a number of these issues. You're right. It's more of a comment. I don't know if anybody else has any questions or any of the other speakers have any comments related to anything that's come up through the afternoon. Otherwise, I think it's time to say goodbye. We do really appreciate everyone joining us and hanging in through the afternoon. This is our longest event yet, and it is certainly new for us to run a series like this, but I've certainly enjoyed it, and I feel like it has been a conversation, and hopefully the conversation will continue. And we do still have the 2 surveys open, which I did include the links in the chat, and they are on our website, of course, and we hope that we can, Terry resisted mentioning that we are working on a guide to stress assess that will include some of the tools and some of the tips and tricks that she included in her presentation. So that should be forthcoming, and hopefully you can join us in the future. We actually have a heat stress webinar planned and already up on Eventbrite, not quite linked on our website yet. It'll probably be up by next week. And we are actually in the conversation about organizing an COVID webinar series, sort of built on our October occupational health and disease prevention symposium, but doing it around occupational health and infectious disease prevention, particularly in the occupational context. So look for that. I will probably send an email out to all of you about that when we get it organized, likely next month, which is just around the corner. So thanks. Yep.
Do you want to mention what we're planning for next year?
Oh yeah, that did cross my mind, and I forgot. So yes, and next year OCOW is actually hosting, or is meant to be hosting, the COPSOC International working group, who will be here for several days, consulting each other about the use of the tool that is the validated basis for the stress assess tool. And then we are planning to include a number of them from around the world will stay and be part of our symposium, which will be in the second week of May, as it's currently planned, which is Canadian Mental Health Week. So in case anybody's, populating their calendar for next May, don't forget to put in that the Mayday Mayday symposium will return. Thanks, John. Did you want to add anything else?
No, but thank you everyone for their patience and their endurance and hanging in there.
It's been good. And Tony did turn the cameras back on, so we can wave at each other if anybody else wants to do that. So, but otherwise, the presentations, as I said in the chat box, we usually get the files downloaded over the weekend from WebEx, and then we'll put them up on our website, which will be at the May Day event page, which many of you may already have seen because the first 4 are already up there. And in fact, Terry's presentation from today is posted already, and the 2 handouts, Terry's and Janet's. So thanks, everybody. We'll see you next time.